Good morning. This is day 5 post-surgery. Just had my breakfast. I'm going to try and put in a picture of the most fabulous breakfast buffet ever. And I'm not even a breakfast person, but yeah, I think I'm going to change my habits. So some of the other questions, of course, there's questions we understand now. It's much less expensive. So how do you pay? What type of currency? How does that work here? Do they speak English? Is there a language barrier? Yes, all of those. Oh, how do you get your medication? All of those are very important and valid questions. One thing regarding the language, I will say if you're like truly American and you've never been to Europe and have not been around international mix of, social friends or whatever, it might be difficult. But if you're, a seasoned traveler, there's no issue. I will say at times I felt uncomfortable in the hospital, a little bit of a language barrier. In the hospital also, it's not as strict as it is in the United States. For instance, when I signed in, they put me in room 512. And then when I went up, they put me in room 53. And of course I'm concerned because I don't want to get the medicine. What if that person in 5-3 has a heart condition and they think I'm that person? So I did make that very clear. I will say Google Translate is your friend. It can be a little bit of a pain in the ass, but I didn't let little things like that go. And there were only 12 rooms on the floor. So the nurse, and also I did have my coordinator with me, and she just said, there's only 5 patients here. So they know, and a lot of times they just assign you a room when you check into the hospital, but when you get to the floor, the nurses have a system and they can reassign you based on their needs. So I would just say be careful. You could be frustrated. I didn't really get frustrated. I just was cautious. So yes, speaking English. The doctors, for the most part, speak English. At least as it relates to medical. It's not like you're going to have a philosophical conversation about Socrates, in English with them. But you can communicate basically, what you need for your procedure. You can have a chat about everyday types of things. And sometimes the most unsuspecting people will speak English, like a cab driver sometimes has better understanding than the doctor. So you never know. And some people you expect to speak English just don't. So I use Google Translate. All of the medical facilities have a coordinator. And as I said, English is because a lot of people from the UK come here, as well as German and Russian. So most of the medical facilities speak those 3 languages. So yes, is it a problem? No. Could it be a problem? I think that depends on your personality. Medications. So they provide both for dental and for the cosmetic procedure. They will provide all of the medication that you need. I'm known as a medical researcher, just for myself. I do it for everybody that has a problem. I research their problem. So I did research on all of the medicines they gave me. I know what the US equivalent was. They do for the face surgery, they do all of the testing. I went to the hospital. I had pre-op testing, which included blood testing, an EKG, and a chest x-ray. And then the medications, post-surgery, they provided me with. Eye drops, arnica cream, some other creams for when I go home, antibiotics, and anti-inflammatory pain medicine. And maybe a couple of other things, which I don't know what they're for yet. He said, when I go back before I leave, they'll tell me. The same thing with the dental. They provide the mouthwash, the medicine, the anti-inflammatory, as I mentioned in my last video. So it's a little different here. I mean, like, the doctor jumped through hoops for me to have my gum surgery on a Sunday afternoon. He had to work with, a different surgeon that did that. And I mean, it's really kind of sweet, and this would never happen in America, but it could also be frightening. So the transportation driver, the taxi driver, had to find a pharmacy that was open. And it's not like CVS. There's not like a huge, here, a pharmacy is a pharmacy. All they sell is prescriptions. So on Sunday afternoons, they're mostly closed. So this taxi driver, he drove me around until we found a pharmacy that was open. Of course, it was packed, a line of about 12 or 15 people. The pharmacy, they don't necessarily speak English. The prescription is not like official. It's written on letterhead from the doctor. So the taxi driver came into the pharmacy with me, helped me, through the process in Turkish. And I mean, that's just so sweet. That would not happen in the United States. The other thing is the pharmacy was so crowded that they didn't even really print out like a label or anything. The doctor told me how to use the medicine, and the pharmacist, he just wrote 3x1, which I know meant use it 3 times a day. But it was handwritten in pen, nothing official, no systems, nothing to sign. So, I mean, that could be daunting. It wasn't like it's an opioid, though. It was, like a mouthwash. I don't know how they would handle like narcotic medication here. I feel like you could be in like stage 5 cancer and extreme pain, and they would not give you like opioids here. So, yeah, I mean, you could be freaked out. I was a little like, oh, that's weird. But I was also like, it's sweet. The cab driver came in, basically held my hand through that whole process. So, what else? Currency. They do like to be paid in cash. There's a huge tax that the Turkish government charges on credit cards. So you could pay with a credit card, but they will charge you maybe 20% more. Yeah, so cash is good. They like US dollars. For all other transactions in Turkey, I would use the Turkish lira. It just keeps things simple. Just look up, like 1,000 lira is about $33, or 100 lira is about $3.30. So just remember that, and you can kind of figure everything out. But they do accept US dollars. They accept euro, of course, and the British pound. It's much easier, though, and it's much more, I think, economical for a tourist to use the local currency. Okay. I didn't pay anything up front either. For the facelift, they did say they needed a payment up front. I mean, that's like their rule, but nobody ever asked for it. So, and the same with the dentist. I didn't pay. I actually paid a little bit when I first went, and then I kind of gave them money in 3 different stages, in the beginning and then at the end. I'll also say, so I did have the gum surgery, and I don't want to say like he upsold me. He absolutely refused to take any additional money for the gum surgery. So it wasn't about, oh my God, we want to like suck more money out of this girl. He said, in terms of getting implants, your bone is critical because it needs to be solid to hold the implant. But once the implant is in place and they put on the prosthetic, your gum needs to be strong because you don't want anything to get behind it. And I had like a bridge over here. See, the implant's not there yet. So my gum was deficient, and he said, I could put this on, but 5 years from now, you're going to have a problem. And he's like a perfectionist. I can give you recommendations. I don't want to do any of that right now, but hands down, my dentist, I loved him. He's a perfectionist. He will not let me leave. He will not take another penny from me. And he even had to have like another surgeon come in and do this on a Sunday afternoon. So this is money out of his pocket. And he said, nope, I gave you your estimate, so this is what I promised, and this is it. So, yeah. I'll talk a little bit about both the doctors. This dentist, he doesn't care if I do a TikTok or a WhatsApp. He's a dentist, so he's an oral surgeon. He's not into like this whole promoting his business. I'm sure he doesn't mind making the money, but, I said, oh, maybe I'll do like a TikTok. I guess at the time I didn't realize TikTok was short. And he really could care less. Okay, what else? I can talk more about the language, whatever. There's a coordinator. I do want to say the very first dentist, when I was the most afraid, the guy that pulled all my teeth, he did not speak English. And in my whole entire life, he is my absolute favorite dentist. He was like, I felt like a Buddha or something. He totally relaxed me. He would like just do my shoulder. He did speak some English, but he would make me feel like, okay, I got you. He would go like this, like breathe, like, I don't know. He just had some really something magic about him. So I guess the language could be an issue. We use Google Translate. I had a lot of fun with him. And he didn't really speak English, a couple words. And yet to this day, I would come back to Turkey just to go to him, really. Okay, more later. Bye.